Your body starts warning you about a heart attack up to 1 month before it happens. The signs are already there. Most people just don't recognize them. This man looks completely healthy, but his body has been sending warning signals for weeks. He has dismissed every single one as something else. Inside his chest, something is changing. Slowly, silently. A month before a cardiac event, the heart gives you signals that could save your life if you know what to look for. Millions of Americans are experiencing these warning signs right now and calling them stress, aging, or just a bad week. This video could change that. Hey everyone, welcome back to the Med Nurse USA. We break down health and nursing topics in plain, simple English. No jargon, no confusion, just information that could save your life. Today we are covering the warning signs your body gives you up to 1 month before a heart attack. These are not dramatic symptoms. They're subtle, easy to dismiss, and critically important. Cardiologists call this the prodromal period, the weeks before a cardiac event when the body is desperately trying to communicate that something is wrong. Here is what it is trying to tell you. Studies show that up to 50% of heart attack patients experienced clear warning signs in the weeks before their event. They just did not connect the dots in time. Let us go through every sign. Sign number 1, unusual and unexplained fatigue. Not regular tiredness after a long day. A deep exhaustion that appears without obvious reason and does not improve with rest. Simple activities that never cause problems before suddenly feel difficult. Climbing one flight of stairs leaves you breathless and exhausted. Walking to the mailbox feels like running a mile. Here is why. When an artery is narrowing, the heart works significantly harder to push blood through the restriction. This extra effort drains your energy constantly, even while you're doing nothing at all. You wake up tired. You feel tired after meals. You feel tired in the middle of the afternoon for no reason. Most people blame their age, their diet, or their workload. It is actually their heart asking for help. Sign number 2, shortness of breath during activities that never caused it before. Your heart and lungs work as a team. When the heart struggles, the lungs feel it immediately. As the heart weakens slightly, it becomes less efficient at moving blood forward. Fluid can begin backing up toward the lungs. Breathing becomes subtly harder. Most people do not notice until it becomes significant. A casual evening walk that was always comfortable now leaves you slightly winded. You stop. You catch your breath. You assume you're just out of shape. But this breathlessness is new, and that matters. Some people find they need extra pillows to sleep comfortably at night. Lying flat causes a mild breathlessness that propping up relieves. This is called orthopnea, and it is a warning sign cardiologists take very seriously. Sign number 3, a recurring vague discomfort in the chest. Not the dramatic crushing pain of a heart attack. Something much more subtle. A pressure, a tightness, a fullness that comes and goes. This happens because the narrowing artery is reducing blood supply to the heart muscle during activity. The heart muscle is not getting enough oxygen. It responds with discomfort, called angina, that most people mistake for something else entirely. People describe it as a dull ache behind the breastbone, a feeling of something sitting on their chest, a warmth or burning sensation. It lasts a few minutes, then passes. They assume it is indigestion or muscle tension. Millions of people take antacids for weeks, trying to relieve what they think is heartburn, when the real cause is their coronary artery. If your chest discomfort keeps returning and antacids are not fixing it, please see a doctor. Sign number 4, recurring pain or discomfort in the jaw, neck, shoulder, or left arm. This is one of the most commonly dismissed warning signs because it feels nothing like a chest problem. The explanation is something called referred pain. The nerves that carry signals from your heart share pathways with nerve from your jaw, neck, shoulder, and arm. When the heart is under stress, pain travels along these shared pathways. Men often experience this as a recurring ache in the left arm or shoulder. They assume they slept awkwardly or strained at the gym. The ache keeps coming back. They keep dismissing it. Weeks pass. Women more commonly feel it in the jaw or neck. A dull, recurring ache that comes and goes throughout the week. Most assume it is tension or dental problems. In reality, their heart has been warning them for weeks. Sign number 5, unexplained dizziness or lightheadedness. Feeling like the room is spinning briefly when you stand up. Feeling unsteady on your feet without an obvious reason. When the heart is not pumping efficiently enough blood reaches the brain. The brain is extremely sensitive to even small reductions in blood flow. The result is that dizzy, unsteady feeling that appears and passes quickly and keeps coming back. Most people sit down, wait for it to pass, and move on with their day. They assume they stood up too fast or need more water. When dizziness becomes a recurring pattern rather than an occasional event, it deserves medical attention. Sign number 6, breaking out in cold sweats without physical exertion or heat. A sudden clammy sweat appearing at rest, while sitting, watching TV, or sleeping, is your nervous system signaling a problem your conscious mind has not detected yet. When the heart is under chronic stress, your body releases stress hormones, including adrenaline. This triggers the fight or flight response, including sweating, even though there is no immediate physical threat in front of you. Some people experience this at night, waking up drenched in cold sweat with their heart racing. They assume it was a bad dream. When this happens repeatedly over weeks, it is a pattern worth taking seriously. An unexplained feeling of anxiety or doom, a sense that something is very wrong without knowing why, is also documented in the weeks before cardiac events. Your body knows before your mind does. Trust that feeling. Sign number 7, swelling in the legs, ankles, or feet, especially toward the end of the day. This is called edema, and when it appears without injury or obvious cause, it can signal that the heart is not pumping efficiently. A weakening heart cannot move blood forward effectively enough. Fluid backs up in the venous system and pools in the lowest parts of the body, the ankles and feet. The swelling is painless, which is exactly why most people ignore it. Shoes that fit fine in the morning feel tight by evening. Socks leave deep indentations around the ankles. People assume they have been standing too long or eating too much salt. When this becomes a daily pattern, see a doctor. So what do you do if you recognized any of these signs? Make a doctor appointment today. Not next week. Not when it gets worse. Today, tell your doctor specifically that you're concerned about your heart. Ask for a cardiac evaluation. Your doctor can order simple tests, an ECG to check your heart's electrical activity, a stress test, a blood test checking cardiac enzymes, or an echocardiogram. These tests take minutes and can identify problems before they become emergencies. Caught in the warning phase before the actual heart attack, these conditions are very treatable. Medication, lifestyle changes, or a simple procedure can prevent the cardiac event entirely. But only if you act on the warning signs. This is what catching the warning signs early looks like. A full life, a healthy heart. Not because the person was lucky, but because they listened to what their body was telling them a month before it became an emergency. Share this video with every person you love over the age of 40. Forward it to your parents. Send it to a friend who has been complaining of unusual tiredness or chest discomfort. This information could genuinely save their life. Hit like and subscribe to the Med Nurse USA for more simple, clear health content every single week. Drop a comment below. Did any of these signs surprise you? See you in the next one.